Charlie Baker addressing the president's guidelines for reopening the country following the COVID-19 pandemic. This as Massachusetts' reopening date remains to be May 4th. Western Mass News reporter Audrey Russo is getting answers. She joins us live with the latest. Audrey?
There's been a lot of talk about the president's three-tiered Opening Up America Again plan. Governor Baker at his press conference today talking about it, saying that the president was wise to defer that decision to each individual state.
The administration has rightly deferred to states to make the best decisions on behalf of their residents. And notably, before any state should consider efforts to slowly return to normal life, health experts urge states to look for infection rates and hospitalization to be on the decline for about 2 weeks. Here in Massachusetts, we're still seeing daily increases in positive cases and hospitalizations.
To the governor's point, we wanted to compare Massachusetts' data from the last 2 weeks and looking forward to the president's reopening guidelines. We also spoke with a local microbiologist about the possibility and the threat of a second wave of COVID-19 cases during that process. President Donald Trump laying out his guidelines for each state to consider when reopening the way of life coronavirus shut down. According to the plan, each state must look at regional data to determine if they meet the proper gating criteria to reopen. The gating criteria mostly revolves around seeing a steady decline in cases and symptoms within a 2-week period. If that criteria is met by a region or state, they can move into phase 1. To then move into phase 2, that same gating criteria needs to be met a second time, and then a third time to ensure a continued decline of coronavirus moving into the third phase. Looking at this on a local level, Western Mass News spoke with microbiologist Erica Hamilton about using county-by-county data and whether or not less affected Franklin County could or should open first.
Here, we're a super small state. We have a pretty dense population compared to other places. So it may not be necessarily a good idea to be county by county, but perhaps region by region, Western Mass as opposed to Central Mass as opposed to the Boston and metro area.
As for the differences between the phases, you can see the gradual reopening of non-essential travel, the slow return to the workplace, and the resuming of school and visits to hospitals. Much of the return to normal takes place in phase 2, after at least 4 weeks of downward case and symptom trajectory. Western Mass News did the math based on state data. Over the last 2 weeks, not only are the number of cases continuing to rise, so is the percentage of positive results when compared to the number of overall tests. Hamilton says opening too early could send us back to square one.
We'll have to pull everything back and go back to sheltering in place and closing non-essential businesses and daycares and schools. We don't want that to happen.
Another critical piece to reopening Massachusetts' first-in-the-nation efforts to perform statewide contact tracing. We'll have more on that on Western Mass News at 6, but for now, I'm live in Springfield. Audrey Russo for Western Mass News.